Raymond Symonds from the University of Leicester in the UK, and he will update us on the CIRCCa study, which is a study with cediranib in combination with chemotherapy in metastatic or recurrent cervical cancer. Dr. Symonds.
Good morning to you. I'm Paul Symonds, University of Leicester in the UK. I want to talk to you about the... Sorry, say all again. Right. Paul Symonds. I'm talking to you about the CIRCCa study, which means cediranib in relapsed cervix cancer. This study was funded by Cancer Research UK in Britain and carried out by the National Cancer Research Network with cooperation from AstraZeneca. I would like to particularly point out a couple of my collaborators, particularly Susan Davidson from Manchester, who put most patients in, and Catherine West, who arranged to carry out the VEGFR studies. See what forward and back is. See if we get this one right. Sorry, can you show me forward? Can you show me forward and back? Why did we do the study? The reason is quite simple. That one, right. It's quite simple. In Europe, 70% of cervix cancer patients are cured either by surgery or chemoradiotherapy. The poor 30% who either relapse or are diagnosed with disseminated cancer have a miserable outlook. Only 20 to 30% respond to conventional chemotherapy, and most are dead within a year. We know that cervix cancer with a particularly efficient blood supply, high angiogenesis in oncology speak, have a particularly poor outlook. AstraZeneca developed a new drug called cediranib, which blocks the receptor of vascular endothelial growth factor, which is one of the drivers of the blood supply and cervix cancer. And previous research in Manchester had shown that patients with a high VEGFR level had a particularly poor outlook. The design of the study was quite simple. We give the patients what we thought was the best chemotherapy, which is carboplatin-paclitaxel. Surprisingly, not well described in the literature, although it's very widely used. And we give the patients either 20 milligrams of cediranib, which is a tablet, once a day, or a placebo. We only treated 69 patients, 34 in the cediranib arm, 35 who got a placebo, but in fact we got very good initial results. The first thing is that we had better tumour shrinkage. We had a response rate of 66% in the cediranib arm compared to 42% in the standard chemotherapy arm. And it's worth saying, actually, the response rate in the standard chemotherapy arm was rather better than we expected. And there was a statistically significant better median progression-free survival, which was our major endpoint. Moreover, looking at the two groups of patients, there's a marked difference in the reduction of the VEGFR level receptor 2 in the cediranib arm compared to the placebo arm. The price the patients paid was more hypertension and more diarrhea, but it was easy to control. The diarrhea was controlled by loperamide. We put the patients on a calcium channel blocker, nifedipine, amlodipine, standard drugs, and it controlled the hypertension. So in fact, the increased side effects were quite easy to manage. This is the survival curve showing progression-free survival. Now, if you notice, there's only a modest difference in median survival, but what I'd like you to look at is the tail, the bottom end of the survival curve. If you notice, there is a significant number of patients alive without tumour progression at more than 2 years. This is true in both arms of the study, but particularly in the arm that had the cediranib. Our future plans which we're doing at present is an individual patient analysis looking at outcome versus VEGFR levels. Moreover, within a few months, the Patterson laboratories in Manchester are going to look at the patient's blood samples again for other biomarkers. These tyrosine kinase inhibitors actually block a fair number of receptors. We want to find out why a significant number of these patients have lived far longer than we'd have expected, beyond 2 years without tumor progression. And this will give us a major clue for our next study and what we should be doing next. If you say, why is this important with women with cervical cancer? Until very recently, there has been no real improvement in outlook for these people. VEGFR has been shown as a useful target. I think we'll get other targets from this study, especially doing the analysis looking in the blood of women who did remarkably well. Thank you for listening.
Thank you very much, Dr. Symonds, for sharing us with this new data.